over there, over there. Send the word over there. That the Yanks are coming, the Yanks are coming. The drums rum-tumming everywhere. So prepare, say a prayer. Send the word to beware. We'll be over, we're coming over, and we won't come back till it's over, over there, over there, over there. Send the word over.
Hey everybody, this is Joshua Littrell. Thank you so much for tuning in here with the Veterans for Cannabis podcast. We're part 2 of this wonderful, amazing podcast here with Dr. MARION MCNABB. She's president of the Cannabis Center of Excellence Incorporated. Dr. McNabb, we were just talking on the previous one about, the experiences and the stories that you had from the patients when you submitted this data back to the people who had voluntarily given this information up, even though it was completely anonymous. Them hearing the information from you, how powerful was that?
Oh, it was incredible. So I remember, we have one partner, Baskin American, for the first study, and we went down to do this, data event. So they made a special event where they invited the patients to come back in to hear the results of the study that they had shared anonymously. And one gentleman, he must have been 25. He came up to us and, after we presented the data, he literally started crying. He had been in a car accident and he had been on several medications. And he had a lot of, interest. He had been on opioids and et cetera, and had a lot of interest in trying cannabis, but was from a very Catholic family, was finally able to convince his mom that, to try cannabis. As an alternative. And so he got a medical card and he started consuming cannabis. And as he started to consume, in many cases, your tolerance builds up. And sometimes you need, larger amounts or higher doses of cannabis, depending on what your conditions are. And so he started to purchase more. And his mom was saying, "Oh my God, you're getting addicted to this. Like, no, you're becoming addicted just like you were to the opioids." And he really struggled. And he's like, "No, and then he had taken the study. And when he heard the results that not only he had gotten off medications, but that many others had gotten off medications, and that he was able to take that home to his mom to explain why, he was just in tears. I mean, I have goosebumps now from this kid.
That is so amazing.
It was very powerful. And that was just one of many stories of people that have really had life-changing experiences with cannabis. And one of those is my good, dear friend and colleague, Stephen Mandile. He is an Iraqi war veteran and an outspoken advocate veteran advocate in Massachusetts for access to medical cannabis. He's been all over the State House. He slept in front of the State House on the bench for like 5 days to get veterans. Yeah, he's a really incredible human. To kind of advocate for veterans access there. And he had been watching our study, and just like you had mentioned, and that the frustration of not having data to back up the claims, and specifically for him in Massachusetts, he was done with that. So he reached out to my company and myself to partner on the Veterans Health and Medical Cannabis Study. So we launched that study, again, with UMass Dartmouth last year, with input from Dr. Stacy Gruber at Harvard, who's a very good colleague and mentor. She advised on the tool development. And we launched the Veterans Health and Medical Cannabis Study. As before, I had mentioned that we had done community education events with the previous study. We decided that it was also really important to do community education events with the Veterans Study. And so we partnered with Ann Brum at Joint Venture & Co., and we launched the study, and then we hosted 6 educational events last year and ended up earlier this year that were around access in Massachusetts and for veterans in general. So we had several great speakers. Dr. Sue Sicily was part of one of our events, Dr. Gruber, Dr. Sulak. We had DAV, or Disabled American Veterans, Easter Seals. I mean, all sorts of really great speakers. to talk about, the findings that we were having and how do we advance access for veterans. So we ended up partnering with, I think it was over 39 different groups, provided support in some way. Some of those were funding partners, some of those were media partners, or, just kind of helping us get the word out about the survey. And we ended up collecting information from 565 veterans nationally, and had some pretty incredible findings, and still more to come. So we'll be doing, you can follow Cannabis Center of Excellence, Inc. on Facebook, Instagram, and on our website, and you'll be seeing much more data that comes out from the study. But overall, we, had 565 respondents. Interestingly, the majority of the respondents, over 50%, were over the age of 50 years, which I find to be very interesting to look at older populations and younger populations.
Absolutely.
Yeah. And basically, their top 3 conditions. So we asked in this anonymous survey, do you consume for medical or recreational or both? What are your top health conditions? Do you use medical cannabis? And if so, which conditions do you use it for? And then similar to the previous study, issues related to access, education, barriers and facilitators for veterans consuming cannabis. So some of the really interesting findings, the top reasons that veterans reported in our study using, or the primary conditions they found cannabis most helpful for, were top chronic pain, followed by PTSD, then anxiety and depression. And, in terms of symptoms that, medical cannabis was reported helpful for, top one being sleep and insomnia, then followed by pain, depression, anxiety, aggression, headaches, inflammation, attention concentration, all the way down to other health conditions such as skin conditions or respiratory, which is quite interesting.
Dr. McNabb, if somebody wants to follow along with what we're doing, is there somewhere that they can get access to this information and the data sets? Absolutely.
If you go to www.canna, centerofexcellence.org, you'll be able to see all the findings that I'm talking about right now, published on our website, and
Beautiful.
More to come.
Beautiful.
Yeah.
And when I looked at it, and you and I have been talking about this for a while now, when I look at the data, I'm not surprised at all, because this is exactly what we've been saying for years. And I know Stephen's been saying the same thing and preaching from the pulpit, if you will, up there as well. This is what all of us veterans are saying. And when we talk about veterans, not just veterans, but patients in general. Hey, it's working. It's working for chronic pain. It's working for anxiety. Yeah. It's working for, whatever it may be, IBS. Why in the world is the federal government not hearing what we're saying?
Yeah, I have a lot of ideas about that. But some I may want to share on a podcast and some not.
Sure.
I agree. I think there's researchers that are coming out now all the time singing these songs. And I think where we are at federal prohibition, things will change when it becomes legal. And I think there'll be much more access for funding and researchers and paying more attention to this. But, what impacts we can have now at a state level, I think is really important. But veterans specifically, it's difficult because the VA is a federal health system.
Yes.
And so, while the VA providers now are allowed and encouraged to discuss cannabis use and to put that cannabis use into, the veteran's health record, they are prohibited from recommending cannabis or really having that one-to-one patient care that's integrated with the overall care of the veteran.
And I think the frustrating part about that is that our listeners have heard that time and time and time again, right? So we have a huge issue that all we're trying to do is help our doctors help us out. That's what this would literally do. But we can't even do that because the VA won't let us do it. Sorry for interrupting, but I had to stick that. It's so frustrating to our veteran community, that we can't have an open dialogue with our dad blame physician that's taking care of us.
Yeah, I know. And, I think what's encouraging is that there is movement now, and maybe this is not as much movement as needed, but movement now at the federal VA level to encourage more medical research and to pass some of that. But I think, even like you said, what our study did was document, what we've heard time and time again, that, cannabis is helpful. And so the more we could just keep singing to those, these points and informing those legislators, the better. I think one of the major challenges, one of the findings that we had in our study, speaking specifically to the VA, is we asked, we asked the veteran, is your VA doctor aware of your medical cannabis use? And 60% said, yes, my VA provider is aware. And then we asked, do you know if your VA doctor supports your medical cannabis use? And 59% said they don't know. So that just shows that there is no dialogue happening.
There is zero dialogue.
Yeah.
And that dialogue was just opened up over the last year, I want to say, where the VA put out a new basically guideline that says if your patient talks to you about cannabis use, you can actually have a conversation with them now. Before then, it was no conversation, no comment. So that's really frustrating that in the last 12 to 18 months, we've finally gotten somewhere to where now we can have an open dialogue with our physicians. But guess what? I've been educating my physician for 4 years at the VA that I use. He finally gets on board, and guess what? I get a new physician. And that's exactly what happens in the VA, So they move, they cycle around, which happens. But it's hard to get people on your side when they can't even – they're handcuffed at the federal level and can't even really talk about it or do anything about it too. Did you have any interaction at all with the VA physicians?
No, not necessarily directly with this study. And through Stephen, we've been, we worked more with the veterans organizations, with the DAV and the IAVA for this particular study, who are also very much in support of medical cannabis research. I think one of the challenges also for VA healthcare providers, in addition to like the federal sort of handcuffing of, so to speak, of, discussing cannabis use, is that there really isn't good quality medical education out there around the endocannabinoid system, not only for the VA provider, but for healthcare providers in general. So I think, any kind of, while I think more research is important, like we said, it's clear that, cannabis is non-lethal. There's never been a documented dose of an overdose. And, we could really be introducing this as frontline clinical care. And in addition to studying the benefits of it. But I think it's really important for the veteran population because, as I mentioned in the previous study, we found a lot of people using cannabis to reduce unwanted medications. In our study, 78% of the veterans, 565, were either using cannabis to actively reduce over-the-counter prescription medications.
78%.
Yeah, that's a lot when you have, a serious opioid epidemic.
Right.
Like Stephen Mandela was on over 50 medications and attempted suicide. And the suicide rate is not okay. And I'm sure that, dealing with COVID right now is not helping any of it. So for me, this statistic, is a public health. I mean, it's an alarm. It's unethical for us to not offer this as an alternative, non-lethal medication. I just
could not agree more. Could not agree more. Let's talk about the numbers real quickly. So I want to run through some of the wards that have been served during this study. And you said there were a little over 500 patients that were in this?
Yep.
So I'm looking at a graph, and I love this graph because 30% of the veterans, that reported, and this is in Massachusetts veterans, 30% were war in Iraq, 27% no war served. Okay, and that's a really interesting number to keep in the back of our head as well. 26% was Vietnam War, 17% were other wars, 13% were Persian Gulf, 10% was the war in Afghanistan, and 8% was war in Iraq, Operation New Dawn. And the first war in Iraq was Operation Iraqi Freedom, which I was a part of back in 2003. And now you've got these different campaigns in the same country